Good morning, good afternoon, and good evening, depending on where you are in the world right now. Ladies and gentlemen, dear colleagues, welcome everyone to this digital event, leveraging pharmacists to minimize the impact of air pollution on health, policy barriers and drivers, an event organized by the International Pharmaceutical Federation, FIP. Next slide, please. My name is Lars-Åke Söderlund, and I'm the president of the community pharmacy section within the International Pharmaceutical Federation. I am also the co-chair for the Congress Program Committee within FIP. And I've been working many years with the Swedish healthcare sector as well as with health systems abroad in improving health and creating a sustainable healthcare system. I have also for several years been working as vice president of the Swedish Pharmaceutical Society and have had a number of executive positions within Apoteket, recently as head of national customers and new business. I've also been the president for the Swedish national project Check My Medicines, a project where we significantly have improved the medical therapy for elderly in Sweden. Today, we are going to talk about leveraging pharmacists to minimize the impact of air pollution on health, policy barriers, and drivers. And we have a number of expert panelists who will share their experiences and wise comments, as well as give us important updates regarding this very important topic, including a call to action. It is indeed a great honor to moderate this event today. Next slide, please. Before we continue, let's just go through some announcement or housekeeping rules. This webinar or digital event is being recorded and live streamed via YouTube. And the recording will be available at our website, www.eventsfip.org. And you may ask questions using the question box provided at the bottom of your screen. And you're welcome to provide feedback to webinars@fip.org. And I also encourage you to become a member of FIP. You will find all the details at our webpage. So please give us your feedback, as this will make it possible for us to improve future events. And ask questions in the Q&A box at the bottom of your screen. And I honestly advise you to become a member of FIP. It's probably the best investment you can ever make. And for your information, a certificate for today's event will also be sent to all participants after the event. We would also like to thank the Clean Breathing Institute for supporting this online event. The Clean Breathing Institute is helping to reduce the impact of air pollution on respiratory health of people around the world, partnering with scientific expertise of academic, institutional, and international bodies, plus medical professionals and innovators from science, technology, engineering, mathematics, and commercial backgrounds to deliver evidence-based and significantly and scientifically reliable information, tools, and practice solutions for this issue. Thank you so very much for your kind support. So let's look at today's agenda or today's program. We will shortly watch a video, Breathe Life, How Air Pollution Impacts Your Body. It's developed by the WHO. We will have a launch of the 2021 FIP and the Clean Breathing Institute's expert roundtable report on air pollution. And we will also launch a call to action. We will experiences from 2 country case studies from UK and the Netherlands. And after that, we will have a panel discussion with our expert panelists. And finally, a wrap up and conclusion regarding the steps ahead. Next slide, please. The learning objectives of today's session is to identify prevailing barriers limiting the deployment of services to reduce the impact of air pollution by community pharmacists. Describe facilitators and enablers that can influence air pollution service delivery by community pharmacists. And understand the policy and regulatory landscape that needs to be established to promote air pollution mitigation services by community pharmacists. Almost every country in the world is affected by air pollution, and exposure has been linked with a range of health effects, including increased morbidity and mortality and respiratory diseases. And air pollution has both acute and chronic effects on respiratory health, affecting a number of different systems and organs. And pharmacy has a key role in supporting patients as well as creating awareness for this slow pandemic killing almost 10 million people directly or indirectly every year. Next slide, please. So it's my great honor to introduce today's panelists, our distinguished experts at today's session. We have Emma Paulino, the FIP Professional Secretary from Portugal, Mr. Paul Sinclair, Chair of the FIP Board of Pharmaceutical Practice from Australia, Anna Murphy, Consultant Respiratory Pharmacist from United Kingdom, Job Van Bowen, Chair of the Dutch Respiratory Pharmacist Group from the Netherlands, and Dina Likens, Policy and Government Affairs Consultant at GSK from USA. Air pollution is an invisible killer that lurks all around us, preying on the young and old. So we have to learn how it slips unnoticed past our body's defenses, causing deaths from heart attacks, strokes, lung disease, and cancer. So let us now watch the video, Breathe Life, How Air Pollution Impacts Your Body.
Air pollution, it lurks all around us, preying on the young and old. It slips unnoticed past your defenses and assaults your lungs, heart, and brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight into your bloodstream, sabotaging your entire body. They inflame and constrict your blood vessels, increasing blood pressure until, one day, causing a stroke. The particle prowlers dislodge fatty plaque that may have built up from your diet. They weave clots that can be deadly blockers of blood flow to your heart or brain. With each new case of heart attack, stroke, lung disease, or cancer, air pollution adds another life to its hit list. Let's stop this invisible killer.
Thank you. In May and June this year, FIP and the Clean Breathing Institute convened an experts roundtable to discuss the global threat of air pollution and its impact on patient care and how pharmacists may contribute to mitigating this important health problem. The first session focused on prime pharmacy practice, aiming at identifying the priority professional services and tools for community pharmacists to support patients and communities in mitigating the impact of air pollution on health. And the second session focused on the education and training pathways and mechanisms for developing the necessary competencies to deliver the services prioritized in the first part. And the objectives of the roundtable were to identify priority needs in terms of professional services and tools, as well as education and training pathways, to discuss how such gaps and barriers can be addressed by FIP and its members, and to produce an advocacy piece, a call to action to encourage FIP member organizations and other stakeholders to prioritize action in the area of air pollution. And you can download this very important document and report, The Global Threat of Air Pollution and Its Impact on Patient Care, Supporting Pharmacy Practice and Workforce Development, at the link provided on this screen. Next slide, please. The key messages in this report is that pharmacists are ideally positioned to tackle air pollution and its impact on respiratory health. As frontline primary healthcare professionals, pharmacy services needs to be addressed to address the effects of air pollution on health, particularly on the elderly, children, and those with chronic respiratory conditions. And such services include differential support for cold, flu, and sinusitis patients, screening for symptoms of the impact of air pollution on patients' health. And there is a huge gap in pharmacists' awareness of the impact of air pollution. And hence, there is a need for pharmacists to be trained and equipped to tackle air pollution. And this training could be delivered through undergraduate programs, CPD courses, and webinars. And there is an opportunity for some community pharmacists to become Breathe Better support centers, delivering specialist air pollution services. And a call to action that has been developed needs to be implemented in a needs-based approach around the world, ensuring that it reflects local priorities. And the call to action is actually a vital tool that can be deployed by pharmacists in creating public awareness about the risks of air pollution and ensuring environmental health literacy, raising awareness of pharmacists' role in managing respiratory conditions, and advocating for adequate remuneration for pharmacists to provide services mitigating the impact of air pollution. And we will shortly learn more about this call to action. Next slide, please. I would also like to take the opportunity to inform you that before we start the event, I want to all of you to know that this week, from Monday until Friday, it is the Clean Air Week campaign. And this includes a pledge of individual commitment based on the key points from the call to action, including 6 key messages that pharmacists can share on their social media. The World Health Organization listed air pollution and climate change as one of the top 10 threats to global health. And according to WHO, air pollution is the greatest environmental risk to health, with 9 out of 10 people breathing polluted air every day. And there is therefore a clear need for pharmacists, not only to respond to and manage respiratory illnesses and symptoms, but also to support proactive respiratory wellness. The 7th of September, today, is the United Nations International Day of Clean Air for Blue Skies. And to mark this occasion, FIP is together with the Clean Breathing Institute launching the call to action, mobilizing pharmacists across our communities to mitigate the impact of air pollution on health. So we invite you all to read this call to action, available in many different languages, and to share it with your colleagues and to become a Breathe Better advocate. Next slide, please. It is now my great honor to welcome Emma Paulino, Professional Secretary of FIP, and Paul Sinclair, Chair of the Board of Pharmaceutical Practice, FIP, to introduce the FIP call to action on air pollution. Emma is a practicing pharmacist at her own community pharmacy in Portugal. She is general manager of EasyFi, a company that engages community pharmacists in the implementation of patient support programs. And she is president of the National Pharmacy Association in Portugal and represents these organizations at various international groups and organizations, such as the Pharmaceutical Group of the European Union and the FIP. Currently, Professional Secretary of FIP and thus a member of its bureau, Emma has previously been chairperson and project coordinator of the Young Pharmacists Group, a member of the FIP program committee, as well as secretary of the community pharmacy section. And Emma is also president of the Pharmaceutical Care Network Europe. And she has also just joined the board of directors of the International Primary Care Respiratory Group. Mr. Paul Sinclair is a practicing community pharmacist from Sydney, Australia. Paul has been a community pharmacy owner for more than 30 years. And Paul is currently the chair of the Board of Pharmaceutical Practice at the International Pharmaceutical Federation and is the immediate past president of the Community Pharmacy section of FIP. Paul has an extensive experience in pharmacy members organizations, including as president of the Pharmacy Guild of Australia, New South Wales branch, and national vice president of the Pharmacy Guild of Australia. Paul served 9 years as a member of the Pharmacy Council of New South Wales, the profession's regulator, and Paul is past chair of the Australian Association of Consultant Pharmacy and has served as a board member of a number of not-for-profit organizations. And Paul is also currently a board member of Asthma Australia, the peak consumer advocacy body for Australians living with asthma. And Paul is a passionate advocate for delivery of professional services by pharmacists from community pharmacy. Emma and Paul, the stage is yours.
Thank you very much, Lars, and hi everyone. Greetings from Portugal, and it's really a pleasure to be participating in this session today, as I've had the opportunity and the pleasure to also participate in the process, as Lars just described. And it has been a truly collaborative effort in order to achieve an important milestone for pharmacists and the respiratory health, I would say. With the publication of the report and now the launch of this FIP call to action on air pollution that had the contribution of so many around the world. So it is my pleasure to initiate describe the document. So it is a short document, as any call to action should be. It is very directive in terms of what kind of contributions the various stakeholders can have and should have if we are to have a positive impact on air pollution. So this FIP call to action has a first page where we have the context, and I will not go into the context as Lars has already briefly and very well described the problem itself and the urgency of the solutions that we are about to present, and also the opportunity for pharmacists in this respect. So I will, in the next slide, move directly into what the call for action includes in terms of action points. Just in general terms, the first part refers to general actions that we call for national, regional, and global policies that promote to promote. So we included a strong and effective action to limit air pollution, and this encompasses, of course, public health measures that reduces risks for respiratory, cardiovascular, and other diseases that are caused by air pollution. We also call for an increased recognition of the role of pharmacists in primary healthcare and respiratory care in particular. This has to be accompanied with an expanded authority and scope of practice for pharmacists in order to manage respiratory conditions. We also call for an increased public awareness of air pollution and the pharmacist's role in managing respiratory conditions and symptoms. We call for the engagement with stakeholders such as patient groups and especially with vulnerable populations. And these include people living with certain chronic conditions. And also expanded authority to vaccinate, as is the case already in many countries around the world. And FIP has been working on a transformation program to achieve an increased scope of practice for pharmacists around the world in order to directly be involved in vaccination services. But obviously, pharmacists have been for already a number of years engaged in the awareness about the importance of vaccination in order to prevent several respiratory diseases. The next section is about how to act. So some examples of hands-on services that can be delivered by pharmacists. And this is very specific in terms of services that pharmacists are offering already in some countries and services that could be offered. So we have services that identify and reduce risk factors, and we are talking about smoking cessation services, teaching about techniques for nasal hygiene, inhaler techniques, etc., and also related campaigns that focus on health education and screening. And of course, these are already being implemented worldwide. We also talk about health screening services to identify these risk factors. And we suggest and recommend the use of validated equipment and questionnaires for these screening services. We also suggest health education services to increase knowledge about the diseases and their treatment, and also develop skills for the correct use of medicines, including devices, medical devices. We also recommend disease management programs that improve health outcomes, tools to support pharmacists in identifying and screening for respiratory diseases, including point-of-care tests that may be relevant to increase awareness on the disease, but also to inform patient referral. And obviously, as a result of this, appropriate referral protocols to other healthcare professionals and health services where needed. Supportive services for people suffering from respiratory conditions, such that can go from minor symptoms like from colds to influenza or sinusitis. Key references that enable action, so the existence of appropriate guidelines and regulatory policies. These are important to frame the interventions. Obviously, we have to enact on remuneration models that are adequate and ensure the sustainability and scalability of these services. And of course, we have to have incentives for all of the stakeholders that are involved in the implementation of these services for them to adopt the services. And of course, for this recognition of this role is important, and it has to be given by the health authorities and the public themselves, as well as other healthcare professionals and stakeholders. With that, in the next slide, I hand over to Paul, who will continue with the third page of the call to action. Thank you.
Thank you, Emma, and good evening, good afternoon, everyone. It certainly is a pleasure to be here today and joining this call to action from FIP. The next big enabler for pharmacists will be education. Quite often it's said at FIP that without education, there is no skilled workforce. If the workforce is to be competent and appropriately skilled, it must adopt the philosophy of continued and lifelong learning. To that end, we call on a requirement for education and training, both at undergraduate and undergraduate level and continuous professional development levels, to ensure the necessary knowledge and skills of the pharmacist to ensure an ability to carry out prevention and screening, patient clinical evaluation, differential assessment of respiratory symptoms in patients without previous diagnoses of chronic respiratory diseases or those already diagnosed. Communication is a huge advantage for the pharmacist. They have established relationships with all of their patients, and the ability to talk to their patients is something that can be further leveraged, particularly with respect to the impact of air pollution. So patient counselling of medicines can lead to improved compliance and much better disease state outcomes. The pharmaceutical care model of practice, including patient advice on the selection of non-pharmacological and pharmacological interventions, including non-prescription medicines. This also includes things as simple as lifestyle counselling and lifestyle advice. Can have a huge impact on people with respiratory compromised conditions. Even as simple as when you might go to exercise. These are all things that can be relayed to patients by the community pharmacy. To also enhance that education and training, that can be achieved with practical workshops for the development of skills, nasal hygiene, inhalation medicines use, technique, peak flow spirometry. Now, some of these may require advanced training and certification, and it may well lead to an advanced scope of practice. And we would say that that's a very good thing, particularly for those pharmacists who wish to engage at the higher level and perhaps have the better breathing centre pharmacies, which are a full respiratory health resource for their patients. We would also encourage and call on organisations to embrace training methods such as webinars, educational videos and tutorials, specific online training modules, and practice guidelines. Now, the needs in different areas will be different, And the availability of technology, etc., will determine what can best be done in delivering education and training to those practitioners. Interprofessional collaboration becomes more and more important every day in our practice. It can be shared, supported by shared electronic patient records, policies and guidelines. And this should be collaboration across the primary healthcare spectrum, so that the pharmacist is part of that spectrum of care where the patient is at the centre of the care. Certainly technology will be a great enabler in healthcare going forward. Interpretation of real-time air quality readings will allow patients to mitigate the risk of respiratory disease exacerbation. Patients will become more empowered with guidance from their pharmacist to take more personal responsibility for their own health outcomes. And a better educated pharmacist will be better able to empower their patients by improving their health literacy. Next slide, please. So at FIP, the commitment that FIP will make is to lead by example. As the global organisation representing all pharmacists, pharmaceutical scientists and pharmaceutical educators, we are well positioned to advocate for air pollution reduction as a health measure, to raise awareness of the health risks caused by air pollution among pharmacists, other healthcare professionals and patient groups, as well as the public. As I said earlier, the pharmacists are well positioned to be leveraged, to be a trusted information source for their communities and to better enable their patients to manage better their own health conditions with the pharmacist support. FIP commits to supporting community pharmacies and their national organisations to provide better respiratory and primary healthcare services by transforming our pharmacy workforce and strengthening our practice and science. This is done already in a number of other disease states by the development of toolkits and reference points for practitioners, and FIP will continue to develop those resources for pharmacists so that they can deliver against this commitment to mitigate the impact of air pollution on health. FIP commits to transforming and scaling up pharmacy education by ensuring high quality and fit for purpose education and training for primary healthcare provision, including on respiratory health and the impact of air pollution on health, and to provide the foundation for workforce development, professional and scientific advancement. One of the great outcomes of this COVID-19 pandemic we're in the middle of has been the adoption of technology for disseminating information and education. So it's never been easier to reach people all over the globe as we are tonight, to disseminate information and to deliver education across the profession. So we will continue to do that at FIP, and we would encourage member organisations to embrace that technology to deliver it to their members. And finally, FIP commits to improving health services for those already affected by air pollution, ultimately improving health outcomes, disease control, and overall respiratory health and well-being. Pharmacists are well positioned to have a huge impact on the impact of air pollution on health, particularly those patients who we see day after day, week after week, but to do it on a structured way, but also in a very opportunistic way to intervene and cause positive health outcomes for their patients. Thank you, Lars.
Thank you so very much, Paul and Emma. And as you can see here on this slide, the call to action is available in many different languages and very soon also in German. Thank you so very much for launching this call to action. It's very important and it's also very timely today. And as you all have seen and heard, it includes both hands-on services as well as education, development of skills, and how to advance the scope of practice. So can we have the next slide, please? It is now my great honor to welcome our next speaker, Anna Murphy. Anna Murphy is a consultant respiratory pharmacist at University Hospitals of Leicester, NHS Trust, and an honorary visiting professor at the de Montfort University. She has over 20 years experience working in the field of respiratory medicine. And the clinical aspects of her post offers assessment, medicines optimization, monitoring, and advice to people with respiratory disease, and working both within an hospital and primary care. People with interstitial lung disease, asthma, and COPD are referred to Anna for medicine optimization and support, in particular prescribing and monitoring of high cost and high risk medicines. Working across Leicestershire, her post includes integrated care and the development of services for respiratory patients. Anna currently works with several national groups and organizations on issues surrounding prescribing in respiratory diseases. And she is currently a member of the UK Clinical Pharmacy Association Committee, the spokesperson for respiratory diseases within the Royal Pharmaceutical Society, and pharmacist representative on the internal medicine, NHS care and clinical reference groups, and chair of the British Thoracic Society Specialist Advisory Group for Pharmacists. And Anna is furthermore co-chair of the medicine adherence workstream of the NHS Severe Asthma Value Scheme and co-chair of the Medicine Optimization Committee of the Lung Task Force. She has published widely in peer-reviewed journals, is author of the Asthma in Focus, and produced the 7 Steps to Success inhaler education materials. And her research interests include medicine adherence in people with respiratory disease and pharmacy practice research. And today, Anna is going to share her experience in a case study from UK. From policy to action, how can pharmacists advocate for action in mitigating the impact of air pollution? Welcome, Anna.
Lars, thank you ever so much, and thank you for such a kind introduction. And I'm extremely honoured to be presenting today. I was also extremely honoured to be part of the roundtable collaboration in developing the call to action. So thank you ever so much for the organising committee, and welcome to you all, regardless if it's morning, afternoon or evening, wherever you are across the world. Next slide, please. So what I really wanted to do in the next 10 minutes is just really look at the policy to action and perhaps what are some of the barriers that we are facing within the UK. This is a UK perspective, although I must put my hands up and probably apologise to my colleagues in Scotland, Wales and Northern Ireland, as I am probably a little bit NHS England and England centric, because that's where my sort of scope of practice is. But however, when we look at air pollution in the UK, it is the biggest environmental threat to the health in the UK. And it's thought to be between 28,000 and 36,000 deaths a year could actually be attributed to the long-term exposure of air pollution. Now, I don't want to talk about costs, but occasionally costs do talk and help us to lever changes in the healthcare system. It is estimated to cost anywhere between 8 to 20 billion pounds based on an environmental health report, and that was back in 2010, so that was 11 years ago. So the costs on health pollution obviously are extremely important to our patients, where there's an increase in mortality and morbidity, but also cost to the health environment and the way that we run our services. We've already heard how the air pollution can cause cardiovascular disease, stroke, respiratory disease and lung cancer. And it's actually estimated that if over an 18-year period we have a reduction of 1 microgram per metre cubed in fine particulate air matter, over 18 years we would actually prevent nearly 51,000 cardiovascular deaths, 16,000 strokes, over 9,000 asthma deaths and nearly over 4,000 lung cancers, and that's in the UK alone. So then when we start escalating it across the globe, you can really see how small action, but urgent action for reducing air pollution can have such a significant impact on our health, let alone the full environment impact of air pollution. Now, air pollution can affect everyone. but it does actually affect the most vulnerable, and that's indoor and outdoor air pollution. And we know that I've just said it can trigger asthma attacks and people die. Unfortunately, the more vulnerable in our society are impacted more, and that may be our older patients, our pregnant children, well, not pregnant children hopefully, but the pregnant and also our children, and those that live near busy roads and perhaps more in deprived areas of our areas. And this is very concerning. Indeed, on the 16th of December, this was in 2020, Southwark Coroner's Court in London found that air pollution made a material contribution, it was stated, on the death certificate of 9-year-old Ella. Now, Ella died in 2013 of an asthma attack. She lived in London on an extremely busy road. It was the South Circular in London, for those that know the city. And it was really actually a landmark ruling that actually air pollution contributed to Ella's death. So extremely sad case, but one that we need to start thinking of how this is affecting our patients. Next slide, please. The good news is that the UK government have policies. I'm not saying that we have implemented these policies and there are still barriers to implementation, but we have a platform perhaps that we can build on. The Climate Change Act of 2008 really set a target by the year 2050 at reducing greenhouse gas emissions. And it was the first sort of legally binding piece of legislation that allowed the government to implement legislation, guidance and incentives really to try and reduce the impact of air pollution. The Clean Air Strategy, which was published in 2019, many felt that this hasn't gone far enough and hasn't really adopted the urgency of the impact of air pollution. But it did at least, and perhaps important for us as well in the UK, it encouraged us to embed air quality training into the healthcare professionals, education and training. It set up the fact that we should have personal messaging for air quality forecasts, and there'd be extra funding to target problem areas. So there was a real sort of start of a push towards trying to reduce some of the impact of air pollution. For myself, who works in the National Health Service within the UK, which in fact is one of the largest employers in the UK. It employs 1.3 million healthcare professionals, secretaries and porters across the board. And the NHS is equivalent to about 4% of England's total carbon footprint. So it was very important when in 2020, last year in October, sort of at the height of, I know, COVID, but it was published saying that the NHS carbon footprint would be net zero by 2040, and with an ambition to reach an 80% reduction by 2028 to 2032. So this is really important for us working within the health service, because it's looking at the impact of care, medicine, supply chain, transport, lighting, digital enhancement within UK NHS to try and help to reduce the impact of climate change. And the UK, of course, is hosting the 26th UN Climate Change Conference in October-November. Next slide, please. For the NHS, the sources of carbon footprint, and I'll just put this slide in because medicines account for about 25% of emissions from within the NHS. Small number of medicines, anaesthetic gases are 2%, and just out of interest, one bottle of desflurane, which is an anaesthetic gas, is equivalent to burning 420 kilograms of coal. Huge amount of impact on the air pollution and climate change. Inhalers, more relevant to my area, practice 3% of emissions, and the remaining 20% are primarily found in manufacturing and freight. Next slide, please. So from pharmacists, I've sort of thought about what we can do and what we are doing, and the proactive action is the prevention of the impact of air pollution on our patients. So yes, there's all the prevention around, us as healthcare professionals taking responsibility for air pollution and climate change. So maybe we need to walk to work, we need to do more ourselves within our own lifestyles. But from a pharmacy point of view, we have a community pharmacy contractual framework, which is a 5-year plan. And as part of that, all community pharmacists are being promoted to become healthy living pharmacy. Now, this is like a community hub, health promotion centre, as well as undertaking the essential services of a pharmacist, such as dispensing, disposal of unwanted medicines, and promoting self-care. But this is a vehicle that I see very much as being used to campaign against air pollution and to raise awareness of air pollution across not only within healthcare professionals, but across all the public within the UK as well. And of course, community pharmacists are at the heart of the high street market, or within more sort of areas where there is deprivation and more vulnerable patients. And therefore, I feel it's so important that pharmacists become part of this air pollution campaign and call for action. And of course, as we know, it's encouraging people to stop smoking and vaccination services, and also perhaps even being involved in helping us to ensure that the right medicines are being prescribed. Next slide, please. So the reactive action is sadly for those people who already have a respiratory disease. And like Lars mentioned, it's about sort of perhaps timely diagnosis, a case finding, pharmacists taking on more advanced services such as spirometry, peak flow management for our patients with asthma, COPD, referral for those patients who specifically might be having lung cancer, so those coming in with chronic cough, perhaps with hemoptysis. These are the type of patients that we need to case find and refer over to the GP services. And there's been a number of case studies and pilots within the UK where this has actually been undertaken. Likewise, we've had some fantastic pilots where the management of asthma, COPD, less so for rhinitis, but have been adopted as part of an advanced commission service by community pharmacists within the UK. And we've had some fantastic outcomes from this in terms of seeing impact. Inhaler and nasal spray technique, medicines adherence, and so on. And there's a number of UK policies that can support this, but unfortunately, some of these aren't being commissioned at this moment in time. For time is something that I don't have a lot of, so I'm going to now move on to the next slide. So inhalers are very important, and I just quickly, and perhaps we'll bring this up in the discussion, this is something that we need to address globally, particularly in the UK, because about 70% of our inhalers are metered dose inhalers. But the global warming potential of a metered dose inhaler is 1,300 times more powerful than carbon dioxide. So we do really need to consider how we prescribe inhalers, how patients use inhalers, how they adhere to them, and how they actually inhale through them to get the best impact and outcomes for our patients, whilst actually trying to reduce the air pollution and climate change from them. And this is just an example of a piece of work we've been doing in Leicester I work, where we've been recycling inhalers to improve unwanted medicines to go back to community pharmacists, for the inhalers to be sent off to a recycling centre. Next slide, please. So just to finish, the barriers, really, we need to make sure the pharmacist's role is recognised to help with the impact of air pollution. We need national air pollution health promotion campaigns, which can be commissioned by NHS England and the governments. We need to really have more tracking of air pollution within the high street, which is where community pharmacists particularly have a role. Education and training of pharmacists and pharmacy technicians, it needs to start at undergraduate level and needs to be throughout CPD. And then we need to encourage the commissioning of advanced services, and these pilots that we've seen across, not only here in the UK, but there's many pilots in Australia and Belgium and all around the globe, where pharmacists have shown their worth in managing chronic disease as asthma and COPD, and really having those services commissioned. They are in fact doing that much better in Scotland than they are in the rest of the UK. And all of us need to sign the Breathe Better pledge and start our action now. So thank you very much for listening. Apologies that I'm a couple of minutes over time.
Thank you so very much, Anna, for sharing your experiences from the United Kingdom. And as we could see, very clear objectives for air pollution in the country, but also showing us both preventive as well as reactive actions. And as we heard from the call to action as well, recognition of the pharmacist's role, education and training, as well as proper reimbursement for advanced services are important factors. And summarizing the last part of your presentation, all pharmacists have to sign the Breathe Better pledge and start action now. Next slide, please. It is now my honor to welcome our next speaker, Dr. Job Van Bowen from the Netherlands. He will also share the experiences from another case study with the same theme, from policy to action. How can pharmacists advocate for action in mitigating the impact of air pollution? Dr. Van Bowen is a health economics and real-world drug outcomes expert specialized in lung diseases. He is chair of the Dutch Respiratory Pharmacists Group at the Royal Dutch Pharmacists Association, principal investigator at the Groningen Research Institute for Asthma and COPD of the University Medical Center Groningen, and was task lead for the European Commission funded project Fresh Air that focused on preventive strategies to cope with air pollution and respiratory diseases in low and middle income settings. It was Uganda, Vietnam, Kyrgyzstan, and rural Greece. He is also author and co-author of more than 120 scientific publications, supervisor of 9 PhD students, and received several research prizes and grants totaling over 6 million euros. He is expert research faculty at the International Primary Care Respiratory Group and European Academy of Allergy and Clinical Immunology, and the editorial board member of various peer-reviewed journals. Welcome, Job. The stage is yours.
Thank you, Lars, for this kind introduction. And I have to start with saying that I'm very impressed by the previous speaker, by Anna's initiatives and all the great work that's going on in the UK. And I always look a little bit jealous to the UK that the pharmacist there has an even more developed role than in the Netherlands. I think even some pharmacists prescribe medicines as well in the UK. And I also discussed in our previous respiratory pharmacist group meeting the inhaler recycling program, which I think it's a great idea. And I hope, Anna, that you have some time that we can discuss how that has been set up in the UK, because we are trying to have a similar initiatives in the Netherlands. But first, let me share some experience that we have in the Netherlands. So if we look at COPD, which is one of the main pulmonary diseases, partly impacted by air pollution, but also by smoking, of course. But if we look at the variation across the globe between, for example, low-income countries and high-income countries. Next slide, please, or next slide. Can you click 2 more times? Yes, thank you. If we look at the left, these are the quintiles of the socio-demographic indexes in the world, which on the top we'll find a high socio-demographic index countries, which have a relatively lower attribution of air pollution to the development of COPD. But if we look at the lower socio-demographic index, we see that almost 40% is attributed to environmental risk factors, including mainly air pollution. So we clearly now know and are aware that air pollution is a global problem, and therefore it needs central coordination. However, to make a truly effective change, we need local strategies. As you can see in this figure, the causes of air pollution, the causes of and the distribution of risk factors, they are different. And also the cause of air pollution, it could be cars, it could be indoor cooking, it could be heating. So these are different across the globe depending on the living environment. So we should be aware that we need a tailored approach to make change. Next slide, please. And what is needed for effective change? I think this is a lesson we can all take into account and apply. Think of your own setting. What can you do as a pharmacist in your country? What do you need to make change regarding the lowering of air pollution and its impact on respiratory and other diseases. It starts with a vision and an action plan. You need a clear plan with a vision. It is logical, it makes sense to people, you can engage people with your vision. Of course, to put this in action, you need skills, but also you need an incentive and you need resources. What if one of those ones is missing? Next click, please. If you don't have a vision, you will create confusion in your team or your country. So you need this clear vision. Where do you want to go? What's the rationale for it? Then you need a plan, a clear action plan. If you don't have a plan up front with clear goals, you start walking in a treadmill like a hamster. So you're just walking without a clear direction and you're seeing the same things all over and over. Then you need skills. If you don't have the skills, as for example, a training to become a more respiratory oriented pharmacist, you create anxiety with yourself and with others. You are getting insecure. Am I doing the right thing here? I think it's a good idea, but I don't know if I have the sufficient skills. So really make sure your skills follow some training program if possible. I noticed one of the great questions in the chat already from, is there an online training program to become a respiratory pharmacist? Not that I'm aware of. Maybe one of the other speakers is aware of one. In the Netherlands, I'll come back to that. We have a 2-year program, which is partly on-site, part-time. But there are some great online conferences and resources to train your skills. For example, currently the largest European Respiratory Congress is going on, the ERS conference. It's a fully online conference of 4 days with great speakers and information about how to tackle respiratory diseases and air pollution. Also, the International Primary Care Respiratory Group has a good website, www.ipcrg.org, for example. But I'll get back to that. Then you need an incentive. Without an incentive, you get resistance. So why should I do it? You need to have the clear why question for yourself, and there needs to be a drive. Else you stop doing something. So you need a clear incentive. And the next one is resources. Of course, you need resources because still, if you know how to do it and you really want to do it, without resources, you get frustrated and you can't continue. So all these 5 factors are needed. So I'll zoom in on each of them and apply them to some of the actions we took in the Netherlands. Next slide, please. So first, the vision and an action plan, which is usually a bit combined, which you described your vision and the actions follow from that vision. For example, if we look at the global action plan for non-communicable diseases, the WHO has a very nice action plan drafted. If you look at the respiratory section, I just picked out some of the bullet points that they wrote related to respiratory diseases and air pollution. They consider cost effective, for example, creating by law creates completely smoke-free environments in all indoor workplaces, public places, and public transport. Also, make sure there's access to improved stoves and cleaner fuels to reduce indoor air pollution. Make sure you apply cost-effective interventions to prevent occupational lung diseases. Treat asthma according to guidelines and provide influenza vaccination to patients with COPD. Next slide, please. However, this is a global action plan. The challenge for you, all of you in this virtual room, is to move from this global vision that the FIP has very nicely laid out now in their call to action. You are the ones that are going to make the change on the local level. And in your country, it might be requiring specific actions or policy actions or local actions that only you know how to do it with your team, of course, and your colleagues. So this action plan should be tailored to your local community, including the risk factors that are relevant in your area. So where's the smoke coming from? Where's the pollution coming from? Who do you need to talk to? Who are the policymakers that can provide resources? Who are your team members? Maybe some nurses or doctors in your area that you need to team up with. Together, multidisciplinary, you're always stronger. What are the needs of the people, of the healthcare professionals, but also of the patients, society? What are the stakeholders? Who do you need to engage with? Who are powerful in your setting? Set clear goals, very important, and incorporate that vision with SMART goals. So I give you an example. In the Netherlands, some years ago, we started a 5-year national action plan for lung diseases. Quite similar, I think, to the plan that Anna just showed you for the UK. This one is not specifically focusing on air pollution alone, it's on lung diseases. But if you look on the figure on the right, and I think it's an open access article that you can take a look at in the International Journal of Care Coordination, we had 5 clear goals that we want to achieve in a 5-year time frame. And I mentioned SMART goals, and you will be aware SMART stands for specific, measurable, achievable, realistic, and time dependent. So in 5 years, that's in T, we wanted to achieve a 25% reduction in hospital admissions for asthma and COPD. We want a 10% decrease in mortality. We want 15% decrease in work-related absence due to asthma, COPD. We want 25% less people starting smoking. So we have a very clear goal that we want to achieve, and together we want to take action. What's the vision for your own pharmacy? If, as a pharmacist, you have to lead by example if you will be the advocate in driving this change. So strive for green pharmacy practice. Delivery of medicines by electric vehicles or by bikes. Make your pharmacy smoke-free. Place solar panels, if available, on your roof. And from the UK, we learned you can collect inhalers and recycle them. Next slide, please. So then we move to the next critical item that's needed for change, which are your skills. Next slide, please. You need to strengthen your skills. So, for example, becoming a specialized respiratory pharmacist. And you need to follow some training on that, I believe. I did myself, attending tens of or hundreds of conferences, reading a lot, learning about respiratory diseases, about air pollution. There's many materials available online. And in the Netherlands, this actually this made us make a standardized 2-year part-time training program for pharmacists that are interested in becoming a respiratory pharmacist. These people will also be registered in a special registry, and they can officially call themselves a respiratory pharmacist. You also, for example, and you saw some of these examples in the UK as well, learn how to screen populations at risk. For example, people that have high use of salbutamol or relievers that they obtain very frequently, so they have many breathing problems. We in the Netherlands, we have an electronic prescription system or dispensing system, and we have specific algorithms that can track these patients with very high use, with many canisters of salbutamol, of this reliever therapy. And we actually invite those people to come to the pharmacy for an inhaler review or refer them to a doctor for additional therapy. Make sure that if your patients are using inhalers, that they get the proper instructions, at least annually. It's not a one-time trick, teach them and they know how to do it. No, more than 70% of people make mistakes in inhaling. So you need to re-educate them now and then, at least annually, we recommend in the Netherlands. Always address smoking cessation. This can be a very brief 30-second advice, just telling them, try to stop smoking because it will affect your lungs, your heart, your brains, and recommend treatment, pharmacological treatment or behavioral treatment or a combination of both. For example, with nicotine replacement therapies, varenicline, cytisine, several drugs that you can provide as a pharmacist. And maybe some of them are over the counter. Agree with your local GPs and specialists, your doctors, on referral criteria if needed, if deemed necessary to make a diagnosis. In the Netherlands, we work with monthly pharmacotherapeutic meetings where pharmacists meet with the local GPs. So it's usually a group of around 10 GPs and pharmacists that discuss specific pharmaceutical topics. like respiratory drugs. In the next month, we discuss cardiovascular drugs, and we look at our local issues, our local patient population, and see how we can make agreements on more appropriate prescribing and guiding patients in how to properly use those drugs. Next slide, please. So then we go to the last two. Those are the incentives and resources that are required to make effective change. Next slide, please. And where can you think of to make effective, to have those incentives? The incentives should be with the pharmacist by yourself, but also by other people that are powerful in making those changes. But you cannot lower air pollution alone. You need the crowd, you need the society, you need policymakers, you need colleagues. So one of the ways that we are now trying to raise awareness is to place a PM 2.5. This is a particulate matter smaller than 2.5 micrometers, so very small particles in the air that are frequently used to measure air pollution. And those meters can be obtained for like $20–30 maybe, but you also have much more expensive one, a couple of $100. But you can place those in your own neighborhood, for example, on the roof of your pharmacy, and measure the air pollution, because without measuring, you cannot advocate for something. You need an incentive to show that the levels are much higher than the WHO threshold of 25, for example. And you can showcase those numbers like on a weekly basis in the weekly journal or newspaper, or place them on the wall of your pharmacy or in the waiting room, so people are seeing how those levels are much higher than the thresholds that are healthy for us. So it creates an incentive for policymakers and society. And if they see this, they may also be able to provide resources to lower this. So it's also a pharmacy incentive, I think, because it provides you with greater visibility as a pharmacist on this topic and more engagement with your patient to actively start a conversation about healthy lifestyles and pollution, not directly related to medicine use. Also, there might be a financial incentive for you, because you can also have the portable air pollution meters that you can sell or rent in your pharmacy to patients to use at home, because the air quality maybe on the roof of your pharmacy or in the terrace of your pharmacy, for example, might be different from people's indoor situation. Within their house, they might be smoking cigarettes, heating with polluting wood or dung, or cooking with polluting stoves. So also they may need a local meter that you can then have a financial resource with if you rent or sell those meters. Also, there might be an incentive. If you start measuring, you can start comparing, you can start tracking if any of your actions have effect. So for example, if you have a couple of those meters in other pharmacies that you collaborate with, you can compare each other's measurements over time and see if, for example, if the air quality improves, that also the number of patients that get to your pharmacy with reliever use, if that decreases. But this is maybe a next step if you have first optimized the measuring in your own pharmacy. Next slide, please. Next slide. So if you have this vision and the action plan, in the meantime, you also should start working on the advocacy. And that's one of the topics, of course, of this webinar. Next slide, please. And how can you advocate as a pharmacy? You can place very low key things. You can place awareness folders or signs in the waiting room of your pharmacy. Very simple solution with a poster or a warning sign or the measurement of the PM levels in your neighborhood. Raise awareness and inform patients and your fellow healthcare providers like the GPs, nurses, societal workers in your area. Provide policymakers, your local policymakers, with study data, or urge them to take action on this topic, that you are a part of this group of FIP, and that you know now you're the advocate for healthy air and to breathe better, and promote seasonal influenza or pneumococcal vaccination for patients with asthma, COPD, and stimulate others to do the same. So you're creating a snowball effect. You cannot change things on your own. Again, you need others, and the more people advocate with you, the stronger will be the effect of your actions. Next slide, please. So in the end, it's all about helping people to breathe better, as cannot be emphasized enough. So provide them with information when dispensing respiratory medication on triggers regarding air pollution. Provide them with tailored preventive recommendations, good ventilation of the homes, use clean cook stoves and heaters. Pay attention to environmental triggers during your home visits that you might be making or your medication reviews that you are doing. Also simple recommendations to parents with young children. Give them the advice to choose a school away from a polluting roads or areas, that children grow up in a healthy environment. Promote the sale and use of high quality face masks if needed, like the MP and R types that block the small particles, the PM2.5. And this is also a kind of financial research you create yourself by selling those, and use that profit to educate people on respiratory and air pollution. Next slide, please. So I have summarized these actions all together in an acronym for you, easy to remember. I hope I coined this term in the previous webinar in August 12 on air pollution. And the acronym is SMASH air pollution. So start with your own pharmacy, lead by example, measure air pollution on the local level, advocate for prevention of air pollution, strengthen your skills and help people breathe better. So having said that, that is the end of my case study, and I'd like to thank you all for your attention, and I hope we can take action together. Next slide, please. Next slide. Thank you.
Thank you so very much, Job. From a global to local action with vision, because without the vision, we don't actually know where to go or if we are doing the right things when it comes to air pollution and respiratory diseases. And also thank you for sharing incentives and resources for pharmacy, policymakers, and society. It is indeed time to smash air pollution and to help people breathe better. It is now time for our panel discussion. So I advise you all to submit your questions in the Q&A box at the bottom of your screen. And can I also ask the panelists to turn on their cameras? I'm also happy to welcome a new panelist to the team, and that is Dina Likins, Policy and Government Affairs Consultant at GSK, to the panel. Dina has worked in public policy and government affairs for over 25 years. She serves as the government affairs lead for GSK Consumer Healthcare North America. And prior to this role, Dina spent 15 years as a lobbyist for the insurance industry, most recently as Associate General Counsel and Vice President of Selective Insurance Company, and as Regional Director of AAA Insurance Company. Dina began her public policy career as a research associate for the Council of State Governments. And after graduating from law school from American University, she worked as counsel to the New Jersey legislature focused on business issues. And during this time, she shepherded major legislation through an enactment related to medical malpractice, predatory lending, telemarketing, and insurance reform. So I now welcome all experts, expert panelists to the panel discussion. And actually, I will start with a question to Dina. Dina, why is the Clean Breathing Institute interested in air pollution and respiratory health?
Just making sure I wasn't on mute. Well, so the Clean Breathing Institute is interested because around 91% of the world's population, they live in places where the air quality levels exceed the WHO limits. And air pollution kills approximately 7 million people each year. In 2019, the WHO listed air pollution and climate change as one of the top 10 threats to global health. Air pollution is linked to several respiratory conditions like COPD, asthma, and bronchitis. it's, it continues to be a growing problem. In fact, I think yesterday it was reported that over 200 medical journals around the world listed climate change, and within that, air pollution, as the greatest threat to public health. There's been a lot of debate and effort put in by countries around, breathing clean air and the importance of that, but it's going to be some time until we get to a world of zero or very low carbon emissions, but we can't, wait, because people need to breathe. So GSK Consumer Health is the #1 respiratory healthcare organization, and they set up the Clean Breathing Institute in 2018 as a semi-independent organization that can help reduce the health impact of air pollution and to kind of increase the quality of everyday life for millions of people around the world. So, the problem of air pollution is complex and it's not easy, but TCBI is creating an open platform to bring the science expertise together and to partner with academic and institutional and international bodies and health professionals, so that we can deliver kind of credible and expert information and the tools and practical solutions that we need to work on this global problem of air pollution. But thanks for the question.
Thank you. I actually will give you a follow-up question immediately. So what are the Clean Breathing Institute's expectations with regards to the implementation of the call to action and the opportunities you see or it sees for the advancement?
So the Clean Breathing Institute would first like to congratulate FIP for this key step in advocating for the strong and effective integration of community pharmacists to improve respiratory health care in the area of pollution. We hope that by this action that the members and pharmacies and pharmacy organizations around the world will be able to identify and prioritize and commit to the implementation of the actions within the call to action. That we want them to really own the actions and put services in place that will help communities, especially those communities that include the vulnerable, and help improve the quality of life. So we think that there's a couple of opportunities here to partner further with FIP at a global level to advance research, policies, and training that could help meet the goals of the call to action, FIP and TCBI as a whole. And another opportunity is that we have a chance to partner with national and regional pharmacy organizations so we can raise awareness, which is a key problem, of the health risks of air pollution. We want to support these organizations to identify and reduce the risk factors and focus on related education and health screening campaigns and services. Thanks.
Thank you so very much. Emma, how can FIP member organizations express a sense of urgency to get the attention of policymakers in their respective countries to take action as described in the document? What are your thoughts?
Well, thank you very much for your question, and it is a very important question, because it's about bringing awareness to the society and instituting that sense of urgency. And I think that from my own experience, it's always good to do two things. One of them is to partner with relevant stakeholders in the community, so other professional organizations, patient organizations that could think about a joint position or a joint campaign and associate it with a certain event or day in the year related to the topic at hand. And for instance, that's why we have the importance of the Clean Air Week events, etc., because you can link your advocacy piece to that commemoration, and together with the other stakeholders create a sense of urgency by creating, for instance, an awareness campaign on the subject, and really showing that there are things that can be done to avert some of the problems that might arise from air pollution. So those would be some recommendations to collaborate with other relevant stakeholders who have can have the same interest, and associate it with a specific campaign during the year, so that you can present it to the government. And I think that making the economic case can also be important to ensure that governments and policymakers do acknowledge the impact that this has, not only in terms of public health, but also an economic impact. So those would be some of my thoughts on this question.
Thank you so very much, Emma. Anna, you have lots of experience from United Kingdom. Could you give one example of an initiative that could be implemented by an FIP member organization to create the awareness of the impact of air pollution on health among pharmacists and beyond?
Yeah, thank you very much, Lars. I think it's very difficult, because I think what we need to do is, all of us on this call today are very passionate about the impact of air pollution, particularly like Job and I are working in respiratory disease. We can see the impact of air pollution on our patients. What we need to do is motivate other of our pharmacists and colleagues working across globally, really, how important air pollution and the urgency for us to try and improve outcomes for our patients. I guess the difficulty is, for us, we have Healthy Living Pharmacists, which is now going to be contracted within the UK for all pharmacists to become Healthy Living Pharmacists. They have to do health promotion. It's incentivized. They're almost paid part of the contract to do that. So to have a national health promotion on air pollution and increase then the awareness not only to the pharmacists but also to the public will be one way that I think we should be moving forward with this and incentivizing our pharmacists to do that. Ideally, I'd love to see a nationwide inhaler optimization sort of service for our patients, so that community pharmacists are dispensing inhalers. They should be the ones which are also making sure the patient can administer the medicines. I think that's a key role for pharmacists. I think we should be that should be seen as a paid commission services for pharmacists to provide that, because like Job said, it's one of the most important things we can do to improve outcomes for our asthma and COPD patients. Many of our patients cannot use their inhalers, 70–80%, depending on what study you read. And actually just very simple messages to our patients can improve not only the outcomes, but also help to reduce the climate change impact of using inhalers. So I was sneaky and had two there from your answer, from your question.
Yes, thank you so very much. Paul, if we look at the call to action, what are the tools and processes that can be adopted in facilitating the uptake of the call to action at the country level? And also, what is the first thing a national professional body should consider to ensure success?
Excuse me, that's better. Clearly, the key here is education. If the member organisations, members will be delivering on this within the local community, then they have to be skilled to initiate the calls within the call to action. So member organisations can take advantage of toolkits that are available through FIP. Member resources that are available through FIP to empower their local membership to be competent in delivering these against this call to action. The first thing that member organisations should do, I think, is recognise the capacity of their membership. It's a requirement that their members are skilled to a certain level to be able to do an effective job and a credible job within their community. So there needs to be training, obviously, and accreditation if necessary, but utilising the local pharmacist as a trusted resource within that community and leveraging that trust that exists with their patients is the first big step forward. So clearly it is an education process that may take the form of accredited CPD, which forms part of required CPD points for a registration purpose. And that CPD is focused around air pollution and respiratory health. The other thing, Lars, that I think is critical is that they should engage with other organisations to collaborate. So to also bring on board consumers. Policymakers now take as much notice of consumers as any other group within the policy spectrum, and member organisations would be well advised to engage and embrace consumers as part of that process.
Thank you so very much for your wise recommendations, Paul. And linked to success, Job, which single barrier could most hinder pharmacists from taking a more active role in supporting patients and the community against the effects of air pollution? I mean, looking at this both from a developing country and a developed country perspective, you have been working in both parts of the world, so to say.
Yeah, thank you, Lars. It's a very important question, but also a very difficult question to mention one single aspect that is a barrier, but there's many barriers, as we have heard here during the discussions. And one of the barriers that have been discussed are, of course, the resources that need to be available, the time. It's not only money, it's also time for the pharmacy, but also the proper training for the pharmacist to for example, provide the measurements, the training for patients on inhalers. So I don't think there's a single problem. I think the access to resources in high income countries is generally easier, of course, but that doesn't have to stop you when living in a low or middle income country from taking part in this action, because I think you can do very important. So what we learned in the Fresh Air program is that we did very low cost interventions to tackle air pollution. Simple things, working together with the World Bank, for example, in providing clean cook stoves to people in communities. But also very brief advice to stop smoking to people, tracking necessary reliever inhaler use as a sign that we need to make a better diagnosis or we need more prevention, tracking antibiotic use in the very young children, while they probably are not having infections but asthma, and they're getting antibiotic courses all the time. And as a pharmacist, you can see that they come back for an antibiotic course but not using like an inhaler for their asthma. So you should be aware of those risk populations. But again, that needs training to know where to look for, and maybe those trainings, that's a role that FRP now is taking with these online webinars. And I'm not sure if there's now one single page available with the full toolkit and training for everybody, and that might be something that could really help also in the low resource settings.
Yes, thank you so very much. Dina, in terms of the potential policy barriers and enablers for pharmacists in implementing the call to action, do you, based on your sort of global experience, see difference between different regions? Like, does the US perspective differ from other regions of the world? Is there a difference?
Well, so within the US, the role of the community pharmacy has it's been traditionally different than, say, in the UK, for example. But in the US, we're seeing that the pandemic actually is kind of evolving and expanding the role of the pharmacist, because during the pandemic and now during the Delta, many Americans don't feel comfortable going to see their physician, or they're not able to. So in that, they've turned to their local pharmacist. And in the US, there's, many more pharmacists than there are physicians. I think the data is that 90% of all pharmacists live within 5 miles of a community pharmacy, and that people feel more comfortable having a conversation with their pharmacist than they do sometimes with their doctor. So it's an ongoing conversation that we have. I mean, some of the issues, and as you mentioned, the policy barriers are that, there's an education component to it. So within kind of the healthcare continuum in the US, we need to look more to kind of multidisciplinary patient care models. And that means there needs to be a better dialogue between doctors and pharmacists so that the pharmacists can understand what's going on with the total patient instead of just kind of that one channel of communication. So we need education tools for physicians as well as pharmacists, and we need a community education component as well of, that people need to understand more about air pollution and how it connects to their health. So the policy barrier is kind of just education, and education could be whether it's during their medical education or kind of a continuing education requirement. Kind of a second issue, I think a policy barrier is that in the US, the 50 different states regulate the scope of practice laws. And so there could be very limiting scope of practice regulations within individual states. Those need to be expanded to allow pharmacists to have these conversations. And then another piece of it is just to have the time in the US. So they need to expand the scope of practice of pharmacy techs so that pharmacy techs can do more of just kind of the filling of prescriptions to free up time for the pharmacists to actually do more consultation because the pharmacies are overwhelmed with business. And so we need to, expand the scope of practice of the assistants and expand the scope of practice of the pharmacists. And then finally, I think kind of the third bucket of the policy barrier has to do with reimbursement in the US. And when you're looking at private insurance companies or even kind of some of our government programs, the pharmacists need to be paid for those times that they're consulting, because right now they're not. They're getting paid for counting the pills. And so we need to kind of review and look at, like I said, through this more multidisciplinary patient care model where paying the pharmacists through a reimbursement model with insurance companies so that they get paid for that time that they are really helping the patients. And so those are the three buckets and policy barriers. And I think a little bit of difference between the US model and some other developing countries. But thanks for the question.
Yes, thank you so very much. Well, time is running out, and I think we need to wrap up this event. Anniken, do we have a slide? Yes, thank you so very much. Well, first of all, I would like to thank our distinguished panelists for sharing their experiences as well as providing us all with wise recommendations regarding the impact of air pollution on respiratory diseases and discussing barriers and opportunities. We now need to build an influential team by community pharmacists. It is time to take air pollution seriously because breathing is key to human survival. But a lot actually depends on what you and I are breathing, and it depends on what you and I are doing. So as the most accessible healthcare provider, community pharmacists can be extremely powerful in this perspective. We have learned today that there is a clear and evolving role for community pharmacists, not only in reactive respiratory illness, but also in supporting proactive individual and community respiratory wellness. And the FIP call to action recommends pharmacy services that identify and reduce risk factors such as smoking cessation, education on nasal hygiene, and optimization of inhaler technique for patients with COPD or asthma, as well as services that screen for vaccine hesitancy and social vulnerability. However, policies are needed in order to increase public awareness of air pollution and pharmacists' related roles, and to scale up pharmacy education in this field. So thank you so very much. Use the call to action to start the movement in your country or in your city. We can't hold our breath while we wait. Now it's time to act, and you are the key persons to make this happen. So once again, thank you to all our expert panelists for sharing your experience and providing valuable insight to our discussion. And thank you to all of you who attended our session. Next slide, please. I would also like you to join me and all our colleagues worldwide in celebrating the World Pharmacist Day on September 25. Pharmacy, always trusted for your health. This is the theme of the World Pharmacist Day this year. And evidence indicates a significant association between trust in healthcare professionals and health outcomes for patients. And this is also closely linked to the theme of today's event. And pharmacy has built up a reserve of trust over many years of caring, and we can put this trust to good use in countering for optimizing the health of our citizens. So I invite you all to join us in this global campaign. Next slide, please. And do register for our other digital events on the FIP web page. We actually have more than 200 digital events free of charge, open for everyone during 2021 until February 2022. So by this, I would like to thank all of you for attending. Once again, a special thank you to our expert panelists, and I wish you a good afternoon. Goodbye.